We don't only stick labels on the boxes. This is the single image of a pharmacist that everybody has, including my mom. I was actually a retail trained pharmacist, meaning that I serve the general population with the general ailments kind of patients. I wanted something different, I wanted something interesting, and I sort of wanted something challenging as well. So the number one hospital that everybody is talking about is NUH. And I searched, and the first thing that came up was an oncology pharmacy position. Yeah, I wasn't confident about it, but I went ahead to apply anyway, and I haven't regretted since. Primary function, of course, is to talk to our patients, to explain to them about their chemo regimen and explain to them about their chemo schedule. And we also discuss with doctors about what chemo to pick. Because chemotherapy is not something easy to understand, especially when they receive their first diagnosis. So then we have to actually break down technical terms to very layman's speak. There are also things like we make the chemo, so it's compounding of the cytotoxic drugs. Then the third thing that we do is actually clinical trials. If you want to be at the forefront of oncology care, right, it's always the investigational drugs. So we also have a unit of pharmacists taking care of the arm. I check chemo chart, I talk to patients, either at the patient fronting end or even at the chemo bay. Sometimes I also call up patients, ask them how they are going with their treatment. So you need to actually put patients' welfare at the uppermost, even beyond your own interests. This is very challenging and very difficult to put into practice, especially in a very fast-paced environment. For me, I think if I see a patient this week receiving the news of having cancer, and then they feel very sad about it, and then I still have to talk to them about their medication. The next week they come, they have a smile on their face and willing to share with me their problems. This actually gives me that energy to actually share with them more. So that's how I think I can manage to do this extra mile again and again and again. So the better I serve, I think the better it is for me. What has been the most rewarding since I joined oncology pharmacy is quite a big difference in my character. Not only it builds resilience in me, because every day I see patients who are less fortunate than me. They are still, trying to get on with life. They are trying to make the best of life. They still come to appointments on time, and they still wait very patiently for their medication. But then they can be still so joyous and so giving and so generous. So then when I reflect on my life values and what I wanted to focus on my character, what I wanted out of life, it gives me a brand new perspective.